When listing roots, prefixes, suffixes, and abbreviations, some examples would be post, which means after, pre, which means before, peri means around, and anti means against. Some medical terms that we would usually use these would be post-surgical care, which means after surgery, pre-anesthetic, periodontal, which means surrounding the teeth, and then antibiotics, which is a common term we use for medications. And then some more compound words or roots we would use would be arthro, meaning joint or articulation, cardi, which would be heart, and then cephal, which means head, and then derm, which means dermat, which means skin. And then more common medical terms we would use that would join these would be arthritis, which means inflammation of the joints, and then cardiology, which is the study of the heart, and then cephalic vein, which means the major vein near the head, and then dermatophytosis, which is ringworm, and then an abbreviation for radiograph or a synonym that we would usually use would be x-ray. When you're describing a dosimeter badge, you'd make sure that it's worn at all times and it's on the outside of the apron. And a reminder is that it does not protect against radiation. It only measures the amount of exposure over time. It has to be evaluated monthly, and reports are given back to the business corporation or to the RSO, which is the designated radiation safety officer, which is normally like a staff member, or it could be like the owner or manager of the business. And then when the reports are given back, you're usually like statistics based on if something needs to change or if your radiation's too high. Usually you notify a staff member of the common concerns, and the RSO duties are the x-ray policies, the storage, the use of the byproducts for the radiation, and then methods of restraint usually used in ultrasound and x-rays would be, first you want to make sure you have all your supplies. You want to have the V-trough, you want to have any tubes you need, needles, extension sets, like microscopic slides to view anything, rubbing alcohol, and it's typically a dorsal recumbency position. You want to use a V-trough like we needed for the supplies. You want to use towels if it's a smaller dog or if you don't have the size that you need. And then if an animal doesn't like the first position, you can always try lateral position instead of recumbency. Very large dogs can often try standing if they're large enough to where the doctor is able to perform the ultrasound or x-ray on them like that. You want to make sure that you only provide gentle restraint, and you want to remember that less is more. And an accessible way must be, if the dog is standing, you want to make sure it's accessible. And then also, if you're trying a position that makes it hard for the doctor to get access, you want to reevaluate, and it's the assistant's job to help make the area accessible to the doctor. You want to pay attention to the patient, like, is the patient in pain? Are they comfortable? If they're sedated, do you need to check their heart rate and respiratory rate often? Like, you want to make sure that you're checking within the amount that is needed every so often to make sure that the patient is normal. You want to make sure that you get vitals regularly. Is the gum color nice and pink, or is it pale? And then after the procedure's over, you want to clean the patient with a wipe, and if it's excess, then you want to get a tongue depressor and scrape off the gel, and then you want to go back over it with a damp towel. When you're explaining the terms that are often used for directions, there's lateral, which means directed toward the outside of the animal. Medial is directed toward the middle. Dorsals directed towards the back. Ventrals directed towards the underside or the belly of the animal. Sternal is directed towards the sternum or chest. And then rostral is directed toward the region of the nose or mouth. And then caudal is directed toward the front or head of the animal. And then when we're using PPE, you want to make sure that it's stored in a flat manner that prevents damage. You want to ensure that you are not overly exposed. Lead gloves must be worn. Most clinics will have thyroid protectors or lead walls in case for safety precautions. And you make sure that your dosimeter badges are evaluated monthly. When you're describing the exposure area in a radiology room and restrictions from radiation exposure, you want to make sure that you are aware of the scatter radiation, because you're usually not affected by the primary beam, but the scatter radiation is affected from the primary beam scattering off the animal. They deflect in all directions of the animal. Like I said, it comes off the animal and it deflects all around the room. And then adjust the collimator and equipment settings to limit exposure to the area. So if you want just a certain area, adjusting those settings may help it. A light is shown to indicate the area that you are x-raying. So if you're unsure of where you're at with the x-ray, there's a light to provide a guide for you. The primary beam is exposed by the light. Technique charts are also available to help you further on directions as needed. And then restrictions, you want to make sure that you remain far from the primary beam. You never want to allow yourself to be involved in the middle or to touch the primary beam while it's being active. And make sure your body does not reside in it. No one under 18 is permitted in the radiology room, and no one pregnant should be in the x-ray room. And then I'm going to explain further with handling and developing radiographic film, and then also explain the difference between digital and film radiography. Basic components of the traditional x-ray machine would be the tube, tabletop, film or cassette, and generator and transformer. You often want to use the Bucky tray to decrease the number of x-ray penetrating through the film. And when you're using digital, some advantages and tips for digital would be replace the film with image plate or a detector. Speed up image making processes, image making processes speed up by decreasing the process time it takes to make the film or for it to go through. So instead of having to do individual x-ray film, it just goes straight to the computer as needed. And then images can be manipulated to an extent, so you can zoom in on the computer or flip it as needed, whereas film, you can't do that because you have a physical copy. Image storage can also be maintained online by PACS helps you to decrease space to store images while having easy access. And you often use a setting machine, which is an electrical current, number of pictures, time, which the 3 stages for that is an electrical current, and then it also helps you evaluate the time, and then it also helps you evaluate the energy, which is in kV. You want to try to get accurate x-ray the first time, so you're not having to overly use radiation or exposing yourself to more of it. And then when you're doing kV settings, if there's only one knob to set, then you just do it to 68 kV. And if there's 2, then you want to adjust to the major setting and then go from there. You want to adjust the light to fit the film cassette. And then safety practice usually happens when you have an exposed margin visible as proof for proper calimation was used, so it helps you evaluate the calimation that was used. And then labeling, you want to make sure that you have the patient and owner info, and then process after confirmed. Use right and left markers to make records accurate, and when you're using digital, you want to remember to use the PACS and directly are transferred to the system, and then have x-ray before exposed.